Pride Week is a time for the LGBTQ community to celebrate who they are in a time that is a lot more welcoming. But for the older generation, the stigma of the past can present challenges when they're trying to access health care. Jess Arnold talked to a nurse who saw a major deficit in care in Northern Virginia and decided to do something about it.
Those rallying today during Pride events have the advocates from decades ago to thank for being able to celebrate their pride without fear. But for many who lived through those times, that fear has lingered into their old age and is affecting their health.
There's this whole history of persecution, discrimination, individuals being estranged from their family members that have made an impact on where we are today and that really make an impact on health outcomes.
Karen McPhail is a registered nurse in Northern Virginia who works daily with LGBTQ patients. And for her, it's personal.
My ties to the LGBT community go very deep. I've had family members, I've had friends. I had friends that I lost during the HIV and AIDS epidemic.
Her daughter proudly identifies as lesbian. But in working with care communities, Karen's discovered that many don't know how to handle elderly LGBTQ individuals. She says that fear from the past causes patients not to seek preventative care for their health. And without proper education, many of the care providers she encounters aren't prepared with support groups or inclusive wording on documents that encourage patients to be open.
You know, and it makes me tearful in thinking about it because honestly, there are individuals in care communities that are hiding. They're not living authentically because they know that they need the care.
A study funded by the National Institutes of Health and Aging that was released just last year says she's right. Out of the 2,500 LGBT adults they interviewed over the age of 50, 21% did not tell their doctor about their sexual orientation or gender identity for fear of receiving subpar health care, which the study and Karen say puts an already vulnerable population at a higher risk for certain health problems like disability and depression.
With care communities, with care providers, within hospital organizations, there is a lack of knowledge. And especially in this Northern Virginia area, there's a lack of options, which is not fair.
She started the nonprofit Aging Rainbows to help coordinate care for these patients and educate care providers on how to handle them. The overall goal is to make sure those who pave the way for LGBTQ rights feel comfortable exercising them. In Great Falls, Jess Arnold, WUSA 9.
Now, Jess reached out to a handful of care providers in the Northern Virginia area to see if they provide services for the elderly LGBTQ community, and she was not able to find even one.